Okay, students, we're going to go ahead and move on now to discuss the treatment of psychological disorders. I want to start off a little bit by discussing the prevalence of psychological disorders. It is incredibly common. We talked a little bit about this when it came to abnormal psych and some of the different psychological disorders. But generally speaking, when we think about the prevalence of psychological disorders in the United States, 15% of adults and 21% of children and adolescents receive treatment. That means that they've gone out and sought contact with a clinician for a psychological disorder in any given year. Some common psychological disorders that adults struggle with include anxiety disorders, mood disorders. Those are our most common, but also things like impulse control, substance abuse, or a combination of these things. Adults also seek treatment for things like relationship conflicts or help with grief, divorce, retirement, or other life transitions. In terms of children, the types of disorders that get treated include things like hyperactivity, oppositional behavior, anxiety, and affective disorders. So what are some basic features of treatment? What features do all treatment techniques have in common? Well, some basic features include things like a client or a patient and a therapist. There's going to be some sort of therapeutic relationship between the client and the therapist, and there's generally a theoretical basis for the treatment procedure. We're going to spend a lot of time in this lecture talking about some of the different theoretical approaches to therapy. And then another a final basic feature of treatment includes is that person receiving treatment as inpatient, or rather are they receiving it as outpatient? Often when we think about different treatment methods, usually those treatment methods come out of or develop out of the presumed causes of the disorders. So in medieval times, when we associated abnormal behavior with things like demonic possession, physicians or priests would try to do an exorcism by making the body uncomfortable. In this particular picture, they're putting this person's head in an oven and trying to get them to exorcise or spit out those demons. Nowadays, we obviously know that the causes of mental health issues are varied, sometimes biological, sometimes environmental, and have nothing to do with demonic possession. So who provides the treatment? What sort of jobs or individuals provide treatment for psychological disorders? Well, obviously psychiatrists and psychologists. Psychiatrists generally are medical doctors with a specialty in psychiatry. They can prescribe medications. Psychologists generally have a doctorate in clinical psychology and see clients and can help diagnose and treat. Other individuals who can provide treatment include clinical social workers, marriage or family therapists, LPCs or licensed professional counselors, psychiatric nurses, substance abuse counselors, pastoral counselors, and other sorts of paraprofessionals. So the first therapeutic approach that we're going to discuss in this lecture includes psychodynamic or psychotherapy. Another word for this is psychoanalytic, and we've talked about Freud. So we start off by trying to answer, well, how did Freud even get started as a therapist? Well, when Freud got started, he really had patients coming into his medical practice, particularly female patients, having various complaints. And what he would do is he would have them talk to him. And what he found was just by this action or this practice of talking about your problems, the person began to feel better. And so he developed this theory around psychoanalysis. And the focus on psychoanalysis is to work through the unconscious thoughts and emotions. So far this semester we've already discussed Freud and how his theory really focuses in on what's going on in the unconscious and how that might contribute to mental health issues. So a psychotherapist is going to try to utilize techniques to help that person tap into the unconscious and be able to root out what is going on. One technique might be free association, where they have the client just say whatever comes to mind. Another one is dream analysis. You have the client, every morning when they wake up, they will write out the content of their dreams, and then they bring that into the therapy session and they examine the content of those dreams. All of this developed out of Freud's medical practice, since he had such success with a talking cure. Psychotherapy is can be very intensive, and it can be very long-term. Treatment may require, or often requires, 3 to 5 sessions per week, and it can take several months to even several years. It's important to recognize the contributions that Freud did make to the therapeutic process. He made some pretty important contributions. The first being the one-to-one method for treating people. Just having a person come in, the therapist being there, and having that therapist listen and talk to the client. He had people take a systematic search for relationships between life history and current problems, being able to look at past life events and look at how those might have impacted or the relationship that they might have to the current problems that they're experiencing. The emphasis is on thoughts, emotions, and motivations. And there's a lot of focus on the client-therapist relationship. Freud would say it's very important that a therapist remain neutral and somewhat detached, because the therapist needs to actively be aware of the issue of transference. Transference is the way the client reacts to the therapist. So a client can become very attached, almost inappropriately attached to the therapist, and this can impede the therapeutic process. When the therapist becomes overly attached or inappropriately attached to the client, that's called countertransference. Freud also said that a clinician needs to be aware of the concept of resistance, which is a client's reluctance to cooperate with the therapist. In fact, Freud wrote, when you start to get resistance, that's when you know you're getting somewhere, because that client doesn't want to go forward. The next steps are going to be the more difficult steps. All right, students, we're going to go ahead and move on to discuss a humanist approach to therapy. We've already talked a little bit about the humanists, and we've brought up the work of Rogers and Maslow. Some of the underlying assumptions that drive a humanist approach is, at first, it's a very client-centered therapy. The client decides what to talk about, when to talk about, without any sort of direction from the therapist. The treatment is meant to be an encounter between equals, not a cure given by an expert. Clients improve on their own time, given the right therapeutic conditions. The thing about humanism is that it's very important to establish a relationship of complete acceptance and support. A humanist approach to therapy really focuses in on rapport, trust building, and making sure that client feels accepted by the therapist. Another underlying assumption is that clients must remain responsible for choosing how they're going to think and behave. That clients are really, in many ways, in the driver's seat. Two of the main practitioners or contributors to a humanist therapy includes Rogers and Pearls. And we're going to start talking a little bit about Rogers first. He called his approach to therapy a client-centered or person-centered therapy. Some of the contributions that he made include the idea of unconditional positive regard. This is the therapist's attitude that expresses caring for and acceptance of the client. Rogers really stressed that to help the client work through difficult issues, they need to get the sense that the therapist accepts the client for who they are. The therapist needs to work on a sense of empathy. This is the therapist's attempt to understand how the world looks from the perspective of the client. And this is done by being genuine, by asking questions that are reflective and are meant to get clarity for the therapist, but also to help the client go deeper. And Rogers also stressed congruence, which is that consistency between the way a therapist feels and acts towards clients. Congruence also means for the client to bring that ideal self and real self into alignment. That's another idea of congruence that Rogers put out there. So you want the therapist to feel and act congruently towards the client, and then the therapist helps that client bring their ideal self and real self into congruence. Perls developed the idea of Gestalt therapy, and this seeks to help clients become more unified. Again, real self and ideal self into alignment. Help them become more self-aware and help them become more self-accepting. The root of humanist therapy is self-acceptance. When the real self and the ideal self are in alignment, when the client can accept who they are, then that alleviates any mental health issues. Behavior therapy. Can we learn to conquer fears? Behavioral therapy is used a lot with phobias and other anxiety disorders. We're going to spend some time discussing it from a therapeutic perspective. So we're going to spend some time talking about behavior therapy and cognitive behavior therapy. The core belief here is that psychological problems are learned behaviors that can be changed. The goal of therapy is to understand the learning principles that are maintaining these undesired behaviors, to learn new responses to those situations, and the focus is on symptoms. It is extremely directive and short-term. So this is very, very different than, say, psychotherapy. So where humanism differs from psychotherapy in the quality of the relationship between the therapist and the client, behavior therapy differs from psychotherapy in that the focus here is on symptoms. It is very, very directive. The client does not set the pace of their clinical work, but rather the clinician sets the workflow and how things are going to be happening. And it's short term. So there's not a lot of time spent in behavior therapy or cognitive behavior therapy where you're going to be talking about family of origin issues. You're going to be talking about your mother. You're going to be talking about past experiences, how those may or may not relate to your current issues. What you're focusing in on is the symptom, the undesired behavior. What's triggering that behavior and how are we going to change it? So some other features of behavioral treatment include the development of a productive therapist-client relationship, careful listing of behaviors and thoughts that need to be worked on and changed, learning-based treatments provided by the therapist, and continuous monitoring and evaluation of treatment. So during this process, ineffective procedures, those get adjusted or they get dropped and new procedures come into play. So what are some procedures or some techniques that behavioral therapists use? Things like systematic desensitization teaches people to be relaxed in the presence of a feared object or situation. So let's say you have a client come in that is afraid of spiders, that has a phobia, arachnophobia. They have a phobia of spiders. The therapist would then teach them relaxation techniques so that when they come into contact with the feared object, they learn how to physiologically relax themselves. They do not go into a fight or flight response, but rather bring themselves down and calm down. And ultimately, the idea here is to have the person get closer and closer and closer to the feared object let's say the spider, to the point where they can hold the spider and be able to relax themselves and not exhibit any fear. Modeling, where desired behaviors are demonstrated as a way of teaching them to clients. So, say someone is afraid, has a phobia of snakes, they're deathly afraid of snakes. You might send them to a snake handler where they observe someone handling snakes. If someone does not know how to behave on a date, you might send them on a mock date where they can observe the way two people interact on a date. You might have them practice something called assertiveness training. If they feel socially awkward or socially inept, they're engaging in situations where they have to learn how to assert themselves. Things like positive reinforcement, presenting a reward after the desired response. Token economy programs are a great example of this. So when you have children that struggle with misbehavior, or you have someone who is struggling with addiction, when they engage in a behavior that is positive, or they do not engage in a behavior that is negative, like drinking or doing drugs, they get a token. And then they can save up those tokens and they can exchange it for something that they really want. Extinction. Extinction is the gradual disappearance of a conditioned response. So there's a couple ways that this can be done. The first one is through flooding, which is an extinction technique for reducing anxiety that involves keeping a person in a feared but harmless situation. An example of this is, again, if you have a client that is afraid of, say, insects, or they're afraid of spiders, and you have them strapped into a chair and you dump a bucket of insects on them or a bucket of spiders on them. They're simply flooded with that sensation. They're flooded with the anxiety. Their heart rate goes up. And after a certain point, they have to come back down and they realize, oh, well, nothing has happened. And there's enough there to sort of get them to that realization, well, what exactly am I afraid of here? A fear of heights, having them go bungee jumping. In that moment, they are deathly afraid. They feel like they're going to die. Then once they get through with the behavior and nothing has happened, they're able to let go of that fear. They're able to extinguish the fear. Implosive therapy. It's an extinction technique in which clients are helped to imagine being kept in a feared but harmless situation. In implosive therapy, they're using technology to help them imagine engaging in a behavior that makes them feel fearful. For example, like flying, or like heights. They're, say, standing on the ledge of a mountain, on the edge of a mountain. But in fact, it's a harmless situation. Aversion therapy, a method for reducing behaviors by creating a negative response to some stimuli. So this is, let's say you have someone come in with a sexual philia. They have a sexual response to, say, shoes. They have a shoe fetish. You will show them images of shoes, and then you shock them. And as time goes on, they connect the shoes with the shock, and they resolve their paraphilia. So here's an image of virtual desensitization. You can see here the spider. The client's wearing a virtual reality display that, under the therapist, is controlling the visual experience. They're seeing spiders of various sizes at various distances, and then they learn to tolerate these realistic images without anxieties, and they slowly become better, and they're better able to fearlessly face the situation in real life. And I like this visual image quite a bit too, because it really sort of helps us to see how positive reinforcement, even for a child with autistic disorder, can be a very powerful tool in getting them to alter their behaviors. So during the pre-treatment baseline period, a child with autistic disorder rarely said please or thank you or you're welcome, but then began to demonstrate such statements once the therapist, but began to make such statements once the therapist demonstrated them and then reinforced them. Did the reinforcement, the modeling actually cause the change? Probably, because the responses didn't start to increase until the therapist began to demonstrate and began to reinforce. Other forms of behavioral therapy include cognitive behavioral therapy, REBT, rational emotive behavior therapy is a cognitive behavioral therapy. This is the work of Albert Ellis. This is a treatment designed to change illogical and self-defeating thoughts. So foundational Ellis's approach is the belief that the reason why people are prone to depression is because they have maladaptive thoughts that are causing their distressing symptoms. And so the technique that Ellis employs is called cognitive restructuring. So you help the person restructure or change the way they think about things in order to help them relieve their distressing symptoms. So some of the maladaptive thoughts, Ellis would call these cognitive distortions that are causing the distressing symptoms, include things like dichotomous thinking, people that think in black and white, using a mental filter where you magnify the negative of any situation, mind reading, oh, that person doesn't like me, or they must hate me, or they must think I'm stupid, catastrophic exaggeration, assuming the absolute worst thing is going to happen, and finally control beliefs, believing that you're helpless. So these are all cognitive distortions or maladaptive thoughts that REBT would work on restructuring in order to relieve these sorts of distressing symptoms. We're going to move on now and talk about some biological treatments. Remember, when we talk about biological treatments, what we're really focusing in on are treatments that are physiological in nature, that are meant to alter a person's physiological state. So we're gonna start off talking about ECT or electroconvulsive shock therapy. This had been a therapy that had been employed particularly to treat depression, but also things like schizophrenia, sometimes bipolar. It's when an electric shock is administered to the brain that is meant to relieve depression, especially for patients who don't seem to respond to other treatments. Currently, about 120,000 people each year receive ECT. This therapy remains very controversial. The side effects of the therapy to some practitioners far outweigh any benefit that might be gotten from it. The primary side effects include loss of short-term memory, sometimes loss of long-term memory, sometimes personality loss, and repeated administration of ECT can cause brain damage. So while this was a type of treatment that was given historically at one time, given consistently, it sort of fell out of popularity, and then it was rarely administered. It is in recent years regaining momentum, particularly for those patients who don't seem to be responding to medications, which is what we're going to be talking about next. But we're not totally clear how it works. The belief is that the electrical stimulation causes the brain to release serotonin, which causes an alleviation of depression. But again, it's a very controversial therapy, and it is given, truly should only be given as a last resort. So most commonly when we think of biological treatments, we're really thinking about medications, things like psychoactive drugs. Neuroleptics are one class of psychoactive drugs. They are basically antipsychotic medications. used in treating things like schizophrenia, and reduces the severity of psychotic symptoms, phenothiazines. About 60 to 70% show improvement. So I want to sort of stop here for a second and talk about that. When I use that term show improvement, I'm not talking about that they are cured. What I'm saying is that the medications seem to alleviate or lessen their symptoms. Part of the challenge with antipsychotics is that they can have some pretty strong side effects, one of them being tardive dyskinesia. This is where a person loses motor control, primarily of the face. They may be unable to control their mouth. They do what's called tongue thrusting, where their tongue sticks out. They may develop Parkinson-like symptoms. So because the psychoactive drugs reduce or work on the amount of dopamine, dopamine smooths out muscle movement. If the person does not have enough dopamine to smooth out movement, they can develop tremors in their hand, tremors in their arm, and basically develop a disease that we see in older adults. Antidepressants. These are drugs that are intended to reduce depression. MAO inhibitors are one class. MAO inhibitors were predominantly replaced by TCAs or tricyclics because we were seeing a little bit less side effects with TCAs. Now these have been replaced with SSRIs, which the most common type being Prozac, again because they seem to be more effective with less side effects. Lithium and anticonvulsants. These are used to treat bipolar disorder. They're often given hand in hand with antidepressants. The idea is to sort of even out the highs and then even out the lows. And then finally, tranquilizing drugs or anxiolytics meant to calm or reduce anxiety. One of the questions that we ask about giving psychoactive drugs or medications to treat mental health issues is that are they necessary? So we've become a society that's very medicated, and we sort of demand or look for a pill to cure our issues. And we have to continually ask ourselves, well, are these drugs working? And so when we, from a research perspective, ask, well, what works better, psychoactive drugs or psychotherapy? What we find is that often it's a combination of both. The medications help with the symptoms early on, but really to facilitate a long-term adjustment and long-term healing. You do need that psychotherapy. You need to get that person talking. Okay, moving on. We're going to start to move out of individual therapy and start to look a little bit more at group therapy, family therapy, and couples therapy. And how does group therapy differ from individual therapy? Group therapy is therapy that involves 6 to 12 unrelated persons. Generally in group therapy, a group of people will meet who may have a common problem, such as substance abuse or loss of a loved one, and they get together and they talk and they offer each other support. Family therapy is a type of treatment involving 2 more people from the same family. Family therapy can be a very powerful tool when you have one person in a family who is struggling with a mental health issue. Say they're struggling with drug addiction or alcohol addiction. Maybe they're struggling with an eating disorder. And the therapist will have everyone in the family come in, talk about their role or what they do in that family that may contribute to the issue. And often family therapists take a systems approach. They see the family as a system and come to understand that just by changing one person in the system can get the system to, or that family to improve. Couples therapy, it's a type of therapy that focuses on improving communication between partners. Couples therapy is very interesting. It's basically the foundation of marriage and family therapy, where you have married couples or long-term partners come in trying to work on their communication or trying to work on their relationship. What's very interesting about something like couples therapy is that it often isn't very successful at improving the person's relationship, and a lot of times couples that come in often end up divorced. So the question then becomes, well, is there any efficacy in offering couples therapy? And what the conclusion is that what often happens is that couples often turn to therapy when they are heading toward the end of their relationship. They are either starting the process of divorce or very close to divorce, and the therapy is really coming too little too late. Some rules for couples therapy include things like always being something positive when stating a problem, maintain a focus on the present or the future, don't bring up issues from the past, and then talk about things that are observable. Focus on behaviors that can be changed rather than making accusatory statements. When it comes to evaluating psychotherapy or different therapeutic approaches, what is going to be the most effective? Sometimes, it really depends. So Eisnick conducted a study that looked at the impact that therapy had on alleviating psychological disorders or psychological distress, and found that therapy generally didn't have very much of an impact at all. Now, this study got a lot of criticism for ignoring different supporting studies and also for misinterpreting data. But what it really led us to is the importance of engaging in what is called evidence-based practice. So that means that you engage in treatment methods that are based on empirical evidence for their effectiveness. And often what happens is that some treatment methods are better for other sorts of disorders. So some of the problems that we have with evaluating psychotherapy includes, how do you measure improvement? How do you know when the person has actually gotten better? There's a broad range of clients, therapists, and treatments involved. We don't see a lot of difference between the three main approaches. And often success is very much related or impacted by the client-therapist relationship. So what I want to really stress here is that though therapists can take different approaches or use different theoretical frameworks for engaging in therapy, when we really start to tease apart what is very effective, it's that client-therapist relationship that seems to be the most important variable when we start to think about client success. So some sociocultural factors that can impact therapy include cultural clashes. A therapist wants to ensure that social cultural differences are not going to impede the delivery of the treatment. This means that therapists need to be sensitive to different cultures. They need to work on their cultural competency, and they need to understand that there is a lot of diversity in experience. On a professional level, it's important that graduate schools work to recruit people from different backgrounds, from diverse backgrounds, in order to ensure that their graduates are diverse and able to serve different sorts of populations. Some basic fundamental rules to a therapeutic relationship include making sure that the client is not harmed by that therapeutic relationship, that the person engages and conducts themselves in the highest ethical standards, and that practices confidentiality. Confidentiality certainly includes services that are given via telephone or even e-health, and confidentiality can only be violated under special circumstances, generally by court order, that a therapist is subpoenaed, or their case notes or SOAP notes become subpoenaed for a case. The most basic fundamental understanding of confidentiality is what happens in that therapeutic relationship stays in that therapeutic relationship and does not get discussed outside the bounds of that relationship. Finally, we talk a little bit about community psychology. It is the most common way clients engage with the psychological community. And the community psychology really tries to focus in on prevention of psychological disorders. The goal here is to treat people in their local communities, to raise awareness of mental health issues, and to work for social changes that can prevent psychological disorders. Community mental health movement has worked to ensure deinstitutionalization. In other words, they see that institutionalizing people with mental health issues is being harmful, and worked for psychosocial rehabilitation, getting people the social support that they need so that they can maintain. Community psychology initiatives address stressful social problems that may underlie some disorders, so things like poverty, unemployment, lack of social support. They attempt to detect psychological problems at earlier stages and prevent worsening, really doing intervention early on and getting that person the resources that they're going to need. They run programs that head off conduct problems and various forms of abuse, things like domestic violence, and programs to promote health consciousness.